The coordination of benefits between Medicare and COBRA is often misunderstood, and it can wreak havoc on your coverage and your wallet if you fail to enroll in the necessary parts of Medicare at the proper time. Hi, I'm Danielle Roberts, and in this video, we will be discussing the Consolidated Omnibus Budget Reconciliation Act, or COBRA for short. I'll show you how it coordinates very differently with Medicare than active employer coverage would if you were still working for a large employer. Stick around to find out how. Employers with 20 or more full-time employees usually must offer COBRA to employees when they leave their jobs. COBRA gives those employees and their dependents the ability to continue their former employer group health insurance benefits for a period of time, usually up to 18 months after they leave that employment. In certain circumstances, it can be longer, up to 36 months. Now, COBRA can be costly because you will often have to cover the entire cost of that insurance coverage yourself. Your former employer is not required to contribute anything toward those monthly premiums like they did when you were an employee. In fact, they can even charge you a 2% administrative fee on top of that monthly premium. So for some people, COBRA is just cost prohibitive, but nonetheless, the right to continue your coverage under COBRA can be important in certain situations, such as when people are between jobs or when they are laid off before they become eligible for Medicare. So it's a good option to have. There are some rules of coordination, though, when it comes to Medicare and COBRA. And you're going to want to know these since, as I mentioned earlier, Medicare coordinates differently with COBRA than it would with employer coverage if you were still actively working. When you are still actively working at an employer with 20 or more employees, that employer group health coverage is usually primary and Medicare is secondary. However, if you're no longer actively working and have enrolled in COBRA to continue that former employer health coverage at your own expense, then the opposite is true. Medicare pays first and COBRA pays second. This affects who will be eligible for COBRA when they are also eligible for Medicare. Let's look at two scenarios. The first scenario is that you have already left your job and are on COBRA before you become eligible for Medicare at 65. In this scenario, when you become eligible for Medicare, you should enroll in Part A and B during your 7-month initial enrollment period. This is because COBRA typically ends when your Medicare begins. Failure to enroll in Medicare during your 7-month initial enrollment period could result in a lifelong penalty on your Part B premiums. Now, I should point out that most people are quite happy to leave COBRA and get Medicare instead as their primary coverage because, as I mentioned earlier, COBRA can be quite costly. And Medicare premiums are typically far less expensive, so there's no question that many people are happy to finally be able to enroll in Medicare and get a Medigap plan or an Advantage plan to help with some of the costs that Medicare doesn't cover. However, what if you have dependents that are covered with you on COBRA and you are concerned about keeping them insured? This is a pretty common scenario where you have a younger spouse or a child under 26 that you are still covering under your old employer plan. If this is the case, check with your plan administrator because if you're carrying dependents on your COBRA coverage when you become eligible for Medicare, those dependents can often keep COBRA for up to 36 months even though you leave and enroll in Medicare. The second scenario is that you work past 65 and then you retire. In this scenario, you are allowed to enroll in COBRA if you want to, but you need to be aware that Medicare is primary and COBRA will pay secondary. You'll be given 8 months to enroll in Medicare once you stop working or your employer coverage ends, whichever happens first. Now, although the federal government will give you an 8-month special enrollment period to enroll in Part B after your last day of work, most people enroll in Part B to begin immediately, the first of the month after their employer coverage ends. Why? Because again, Medicare pays primary and COBRA pays secondary. If Medicare is going to pay primary, then you need to be actively enrolled in Part B. You need Part B to be in force and covering your outpatient services when you have them. Otherwise, you're essentially running around without any primary outpatient coverage to pay for things like doctor visits, CT scans, outpatient surgeries, and even chemotherapy. Not a good situation, and that's not all. Let's say you didn't know this and you didn't enroll at all during your 8-month special enrollment period for Part B. Your failure to enroll in Medicare within that 8-month window can also result in a permanent late enrollment penalty for Part B. Even worse, it could delay your enrollment into Part B until July of the following year. You do not want to find yourself in a situation where you must wait months and months without any outpatient coverage before you can enroll in Part B during the next general enrollment period. Lastly, if you do decide to keep COBRA as your secondary coverage to Medicare, you may be able to delay enrollment into Part D if the drug benefits inside your COBRA plan are considered creditable for Part D. Check with your plan to confirm. Now, once COBRA runs out, that creditable drug coverage ends. As with many things in relation to Medicare, there is one exception that I want to mention here, and that exception is for people who have COBRA when they become eligible for Medicare due to having end-stage renal disease or ESRD. In this scenario, you don't have to enroll in Medicare immediately. COBRA will pay primary during a special 30-month coordination period between Medicare and COBRA that begins with the month you first become eligible for Medicare due to ESRD. Now that you've learned what you need to know about Medicare enrollment when you also have COBRA, next you'll want to learn what Part B will cost you when you sign up. For more on that, check out this video, and I will see you in the next one.